Dr. Arvind, thanks very much for speaking to the Logical Indian. These are testing times for everybody in the entire country right now, and we're all juggling with how to cope up with staying alone. And staying indoors as well. Many of us are staying alone, working professionals, and many of us are staying indoors within our own families. It's especially difficult for those who are not used to of it, sir. So I want to first begin by asking you, is it something that is problematic, or is it just in our minds? Is it something that we are creating a hullabaloo about mental health in the times of coronavirus, or is it something that we should take very seriously?
It's more than, it's not really made up sort of situation. Let's just leave Corona. I will give you another other example. It is something to do with conditioning our mind. For example, you just go out for an, outing to an hill station. You would be enjoying it for 3 days, 4 days. And if you are asked to stay there for the next 15 days, 20 days, you feel like coming back to your place. It is something called as conditioning in terms of psychology. So when we are conditioned to this, and from the social point of view, sociology point of view, we are called as social animals. We tend to socialize with people. There are people who are very social, but again they go back with groups. So that's the difference. But rather the similarity is, people would love to, or basically human beings would love to go and see things, and it really, that's where exactly this boredom sets in. Even if you do the work what you love, even if you do that continuously, and that's where exactly the boredom sets in. So it is just not about coronavirus or COVID-19 situation. It is about the condition which we are not used to before, and now we are forced to also. And that's where we get in. And because these are the first few days, we may not feel that actually. But as the time goes, there can be a lot of such things which will really create some sort of, it is not really a mental health problem as such. It is to do with well-being. Our mental well-being or well-being itself is just not just physical well-being. It is also physical, psychological, as well as social well-being. To keep these things in mind, that's what they are talking in terms of mental health as such. When you talk about mental health, all these three things matters. If you leave it without addressing it, it will drift towards mental disorder. If I address it at that level, it will drift towards mental health, and that's where we need to really focus on.
So addressing the problem is where we need to focus on, sir. That's what your message is.
Yes.
Right. I also want to know from you, in the times of disaster or following disaster, there is, of course, an extended period of psychological problems that people deal with. And that is something that we are seeing even right now. More than, I suppose, loneliness, many people say that the negative environment around them is also causing mental harm. So how do you then protect yourself?
See, that's what they say is that what we are seeing around, when it says that it is affecting us, again, it is our responsibility to make things around us in a positive way. For example, in a family context, I need not keep talking. Being a breadwinner of the family, I need not keep talking about the negative consequences which is happening around. So I should be able to talk about some generic things which will keep my family members' mood up. So this, me as a breadwinner, someone who's a leader of our organization, or a leader of an association, or for example, a political leader, or a person who is from a government official, they also should be able to boost up the environment's mood by the way they look at things. So the situations remain same, but what we look at it, it's some simple example, like if 50% of the glass is empty, let's not talk about that emptiness. What is there, which is already there filled? For example, they talk about so many people have been infected by COVID. But what about the people who are getting recovered? So these are all some of the positive things which we need to keep talking about, so that automatically the environment becomes positive.
Okay. So you're saying it's in our hands. If we want to change the environment around us, we can change the environment around us. So I want to talk about age groups, because various age groups deal with loneliness different. You have the working professionals like you and me,
Yes.
who never perhaps sat at home in last so many years, and suddenly we are at home, and it becomes overwhelming. How do you
Yes. Yes.
advise people like us when you're meeting them? What do you advise people like us? How should we as adults and we as working professionals cope up with it?
In the situation of lockdown and in the situation
Yes,
of
yes.
home isolation,
The
yeah,
situation of isolation,
one,
work from
it's,
home, and not meeting
yeah,
your
yeah,
colleagues every day. Yes.
exactly. One thing is avoid looking at these TV news channels too much.
Okay.
Exactly about this corona. Even if you open your mobile phones, the news which pops out is all about coronavirus.
Mm.
It is not that the more you see about coronavirus, the impact is going to get down. It's going to be the same. In fact,
Mm.
it will only add up to our mental agony.
Mm.
So it is all about on what else you are channelizing your cognition.
Okay.
Like the earlier routines, what you were doing
Mm-hmm.
in terms of planning, in terms of talking to your family members. These are the things which we need to keep up in terms
Mm.
of our cognition as such. In
Mm.
terms of physical activity, earlier people would have gone out for a walk and other things. Just try to, what is the connection between this physical activity? Basically, this physical activity helps us to, get in some hormonal activity. For
Mm-hmm.
example, serotonin, and these are the hormones which are
Mm-hmm.
responsible for stress in a human body. So the
Mm-hmm.
more these hormones are secreted, the better is a human body which will be able to react positively to a stressful situation. And that's
Okay.
exactly why we are talking about this physical activity a person should have that
Mm-hmm.
breaks the monotony. The
Okay.
idea is even working from home, again what happens is that it's just not in COVID situation. I had interacted with software professionals who have this habit of work from home. There is a different set of problem. The thing is, there is no clear demarcated boundaries between personal life, family life, and work life. So
Yes.
that becomes a big problem not only for these people, also the family members. Family
Mm-hmm.
members are not able to find time with the person who's work from home. They are not able to find time, personal time and family time. So
Mm-hmm.
it is left to us to demarcate the timings for all these three things.
Mm-hmm.
So that way you can still work from home for these situations, but by doing these activities, it will be helpful for us to break that monotony. Otherwise,
Okay.
this monotonous activity is one thing which will also give us burnout. Even
Mm-hmm.
if you are so interested in it, I cannot monotonously do one particular thing.
Okay. So for the benefit of
this
viewers, I'll
this
just
is
quick.
what we can do about
Yes,
this.
for the benefit of viewers, I'll quickly repeat that. The three things that you suggested, obviously, is making sure that you do physical
Yeah,
activity. That's first. Making sure that you, separate your work life from your personal life, and then also give time to people around you, your neighborhood, your people in your home, at your
yeah,
family. So these three things perhaps can help adults. What about children, sir? Because children, it's
yes.
very difficult to contain them indoors. Young kids, it's very difficult. And when we tell them, you look, don't go out and play with other kids in the
Yes,
community,
yes,
it
yes.
just sort of takes toll on them. So what alternative would you suggest as an expert?
Very true. Because when it comes to children, I myself face this situation with my 10-year-old daughter.
Mm-hmm.
Like my wife was proudly saying to someone, so now my daughter is having home food every day.
Uh-huh.
But we were expecting a positive reply from my daughter that yeah, I'm having home food. But she was like, you know but rather I like my school food very much. So
Mm-hmm.
here what I'm trying to do is, I'm not telling her what are all the things she's not supposed to do. Rather,
Mm-hmm.
I am creating opportunities for her, what she can do in the given limitations. For
Right.
example, we also juggle between these household activities. I sit with her and play carom board.
Mm-hmm.
I just play carom board, which I have
Mm-hmm.
never done before.
Okay.
The children, of course, it's also a chance for us to have quality time with the children, which
Mm-hmm.
we missed because of this home from work, or a
Mm-hmm.
work from home, or our busy so-called busy schedule.
Okay, so it's an
Yeah,
opportunity. It's like, looking
Exactly.
at a silver lining in the clouds, that it's an opportunity for
Yes.
everyone to spend more time with each other.
Very
But
true. Very
since you talked about a family unit,
true.
sir, and families are coming
Mm.
together after a very long time,
Yeah.
spending so
Yeah.
much time together. Uh,
Exactly. Very true.
Right. So what exercises, I mean, what sort of exercise or daily routine would you suggest to a family to follow in these times? Since we talked about adults and we talked about children, but as let's say a
Mm-hmm.
woman of the house, because there's a lot of responsibility on the woman of the house. What would you
Yes.
suggest to
Yes.
her?
Yes.
How should she manage the family in these times? What all activities should she make sure are a part of her daily life? What should be done? What not should be done? Any tips or
Okay.
for them, for women of the house?
Yeah, like when you talk about women of the house, I would just not restrict my suggestions only to the women. As a family, for example, me staying back at home, there should be some sharing of responsibilities, because most of the time she will be playing a multiple role where she
Right.
will be cooking, and
Mm-hmm.
if she is also working from home, she also has to do that, and as well as she has to take care of the children as well as household chores. So
Mm-hmm.
it is the other spouses, that is, suppose if it is women, the husband's responsibility is to share. And it is very easy for the other spouse to say that, in the sense, the better off to say that you never told me about this.
Mm-hmm.
It's an excuse. So women also should not give way for this excuse. Rather,
Mm-hmm.
whatever they feel, no, when they are sitting alone without kids, when they are discussing something, they should be able to talk about these things in an assertive manner. Otherwise, there is no way the other person will know, this is
Mm-hmm.
how I have hurt the other person, this is
Okay.
how I could have helped the person. So most
Right.
of the time it is that individual's assertiveness which will make the other person to respond appropriately. And
Mm-hmm.
especially in our context, women, either they are so submissive, they don't talk anything, they just take it, and that's how
Mm-hmm.
they all have the psychosomatic responses,
Mm-hmm.
body pains, different body pains without any base. Or
Okay.
they're so aggressive,
Mm-hmm.
they yell at others, for example, displacing anger on children. Sometimes there will be even violence from wife's side towards husband, or
Mm-hmm.
sometimes there will be some sort of suicidal attempts. These are all
Mm-hmm.
aggressive behaviors.
Okay.
Instead, if they're assertive, they just want to pass on the message what they wanted to say rather
Oh,
than reacting. That is what
okay.
is very, very important.
Mm-hmm. So rather than being submissive or being violent, be
Yes,
assertive in what you're trying to
assert.
tell your
Exactly.
spouse, right?
Yes,
And
yes.
so my final question perhaps is, and we're talking about a normal family unit, but I'm very
Hmm.
certain that it's been an extended period of work from home for many of us, and some of us are
Yeah.
already feeling very isolated, some of us are feeling
Hmm.
overwhelmed. What sort of advice do you have for them? Any contact details that you can perhaps share? Any numbers that they can call on and speak to
Yeah,
experts,
yeah, yeah.
and how do we mitigate the situation?
See, unlike the other disaster situation, where
Mm,
there are chances for the psychosocial experts or mental health experts to visit these families, in this disaster situation, it is not possible
mm,
because of the social distancing. This is not possible. However, for example, I belong to this discipline called psychiatric social work. So
mhm,
we have an Indian
mm,
association of psychiatric social work professionals.
mm,
Similarly, clinical psychologists who are also mental health professionals, they have Indian Association of Clinical Psychologists. What we
mhm,
have done is we have created a team of volunteers who have
mhm,
come forward to give their personal numbers as well
mhm,
as the convenient time where they can call us up,
mhm,
and they can discuss about the whatever the difficulties they are facing, both from the mental health point of view as well as from the psychosocial point of view. As
mhm,
much as possible, we would be able to help them, and also we would be able to give them the available resources which they are not aware. For
mhm,
example, in the state of Kerala, 2 months elderly pension, that is old age
mhm,
pension, that is
mhm,
being given in advance. Sometimes
mhm,
these elderly people may not know about it, so we
mhm,
can help them to know about that information, also get them in touch with the respective department people. For government of Karnataka, 104 is helpline number. So this 104 is also linked to all our numbers. So when people call 104, they will all be rerouted to different people based on the problem what they are asking, the solution what they are asking for. That way.
Okay.